My name is Seth Baird. I am a PGY1 internal medicine resident at Unity Health in Searcy, Arkansas. I'm presenting Fingernails Nailed Down, a proposed system for diagnosing nail disorders. This project started when I was a third year medical student, going through my clinical rotations and noticing that my internal medicine attendings would use nail bed disorders and nail bed findings, both in the fingernail and the toenail, to come to conclusions about the systemic disease processes that our patients had. However, when I went home and tried to study these disorders on my own time, I noticed that the textbooks and other resources would categorize nail disorders based on their etiology. This was frustrating as a learner because I had to learn all of these systemic diseases or specific disease processes individually and then relate them to a physical nail finding rather than just learning how to approach classifying a nail disorder based on its physical appearance. So I proposed that we do just that. We build a system where using simple visual and tactile cues from the physical exam that we lead ourselves to the systemic disease processes associated with those findings. I initially did a literature review where I didn't make any exclusions regarding the time that the date of publication is for any of these resources. And I also didn't want to discriminate against any particular specialty like dermatology versus internal medicine. So I cast a wide net, and essentially everything I saw was classifying nail bed disorders only on the etiology. So I gathered all of the physical characteristics that I could think of that were common amongst some of these groups of disorders, and I ultimately came up with the damaged, detached, distended, dented, discolored, and diseased model. So for each of these terms, I have a diagram that lays out an algorithm where a few simple questions regarding the number of nails involved and the area of the nails involved, along with a few other questions, can quickly lead to a diagnosis. So let's look at our picture here in the middle of the poster. This is a picture of Terry's nails. So, in order to make this diagnosis, we would say this is a discolored nail, specifically white, and it is a section of the nail rather than an isolated lesion. So, we move to the next question. Does it take up more than half of the nail? Yes. The next question is, does it take up the whole nail or only partial? This one is only partially included. So this would be the Terry's nails, the proximal 2/3, which is classically associated with cirrhosis. If we look at the picture below, this would be a nail where your first thought is this is a dented nail. So what is the location of this dent? Is it on the proximal half of the nail or is it along the whole nail? This one is a mid nail finding. So we would go down this middle path here on the diagram in figure 2. Then we would look at the orientation of the dent. Is it longitudinal or transverse? This is a transverse dent, so this is Bowes lines, classically associated with an acute disease process where the body converts its resources or diverts its resources to another setting. So this is like major infections, things of that nature, and the nail bed halts growth temporarily. This causes a dent in the nail bed when it begins to regrow. So we have here two QR codes where you can scan in to find the poster itself, which I'm presenting now, as well as a list of all of the diagrams for each of the damaged, dented, detached, distended, discolored, and diseased nail algorithms that I've laid out.